Many people believe, if I feel fine, my blood pressure must be fine. In my clinic, I see people every week who felt perfectly okay until their numbers told a very different story. Let's be honest together for a moment. You probably check your phone battery without thinking. You probably glance at your car dashboard when you drive. But blood pressure, the pressure that feeds your brain and heart, is often checked only once or twice a year. And when you do check it, you may think, why is this number different every time? Did I do something wrong? Should I worry? If you've ever felt confused or unsure, that's very common and very human. Hello, I'm Dr. Claire Carter. For the past 10 years as a preventive health physician, I've seen patients in my clinic every day for blood pressure checkups, and I help them understand what their numbers really mean, without panic or fear. Today, we'll go through this calmly, clearly, and without panic. No medical jargon, no pressure to be perfect, just understanding. In this video, I'll explain 3 things: how to measure your blood pressure correctly at home, how to choose the right blood pressure machine for your body, and when to measure your blood pressure so the numbers actually help you. Everything you'll hear today is meant to make you feel more confident, not anxious. By the end of this video, you'll know why many home readings are accidentally wrong, how to avoid false high numbers, and how simple habits can improve your readings by 5 to 10 points, just through better technique. Stay with me, because understanding blood pressure often changes it. Most people think measuring blood pressure begins the moment they press a button on the machine. In reality, the process starts much earlier, often 5 to 10 minutes before the measurement itself. Your body responds naturally to movement, talking, stress, or even subtle emotional tension. If you rush into a measurement, your reading may be higher than it actually is. Not because your blood pressure is dangerously elevated, but because your body is simply reacting to recent activity. Think of it like checking water pressure in a hose while someone is pressing down on it. The reading changes even though the system itself is fine. To get an accurate reading, preparation is essential. First, choose a quiet space where you can sit undisturbed for a few minutes. Before sitting down, take a moment to relax and let your mind shift away from any pressing tasks or worries. Sit on a stable chair with your back supported. A soft cushion can help if your chair is too firm, but make sure your back is straight. This alignment helps your heart, lungs, and blood vessels function naturally, giving a more precise measurement. Your legs are just as important as your arms during measurement. Keep both feet flat on the floor. Crossing your legs can increase readings slightly by affecting circulation. Even small changes in posture can influence the measurement more than people realize. When your body is positioned correctly, the machine can accurately capture the pressure your heart needs to push blood through your arteries, giving a true reflection of your cardiovascular health. Now focus on your arm. Your arm should be fully supported, resting comfortably at heart level. Holding your arm up or letting it dangle can alter the reading by several points, creating unnecessary concern. The cuff should be wrapped snugly around bare skin, not over clothing. Even thin fabrics can interfere with the pressure readings, so bare skin is always preferred. Make sure the cuff is placed according to the manufacturer's instructions, usually about an inch above the bend of the elbow, with the bladder of the cuff centered over the brachial artery. Once the cuff is in place, sit still and breathe normally. Avoid talking, moving, or holding your breath during the measurement. Your blood pressure is dynamic and responsive. Even small actions like clenching your jaw or tapping your fingers can cause temporary spikes. This is not a test of patience. It's a moment to listen carefully to your body. Each reading provides insight into how your heart and vessels are functioning at that precise time. And accuracy matters because small errors can lead to false conclusions. Consistency is also key. Measure your blood pressure at roughly the same time each day under similar conditions. Morning measurements are often recommended before food, caffeine, or medication, while evening measurements can be taken after you've relaxed for a bit. By keeping the environment and timing consistent, you reduce the likelihood of misleading fluctuations. Over time, patterns emerge that reflect your true cardiovascular health, rather than isolated readings that can create unnecessary worry. For people who struggle to stay calm, taking a few slow, deep breaths before beginning can help normalize readings. Breathing naturally helps lower temporary spikes caused by stress or anxiety. Some patients find it useful to practice this for a minute or two before applying the cuff, treating it almost like a ritual of checking in with their body, rather than a medical test to be feared. Even the smallest details matter. Check that your clothing is not pressing against your arm, avoid talking with others in the room, and keep your body relaxed. These small adjustments are easy to overlook, but can make a significant difference in the accuracy of your readings. Over time, learning to measure correctly becomes second nature, and patients often notice that their readings are more stable and reliable, reflecting real changes in their health rather than artifacts of posture, stress, or rushed technique. In my clinic, I emphasize that correct measurement is about precision, not perfection. You don't need to perform this flawlessly every single time, but paying attention to these key steps ensures that your readings are meaningful and actionable. Once you master the preparation, posture, and cuff placement, the process becomes intuitive and less stressful, giving you confidence in every number you record. Accuracy allows you and your healthcare provider to make informed decisions, monitor trends, and implement strategies that genuinely support heart and overall health. Remember, measuring blood pressure correctly is more than a routine. It's a simple, empowering practice that gives you insight into your body. By approaching it thoughtfully, you turn each measurement into a reliable piece of information, not a source of worry. Over time, you'll gain a clear understanding of your cardiovascular patterns, which is the foundation of prevention and long-term health management. Here's something surprising many patients tell me. Their blood pressure drops within days just by measuring correctly. Which part of this setup do you usually skip? Sitting quietly, arm support, or breathing normally? Why small mistakes change numbers. Blood pressure is sensitive, and that's not a weakness. It's how your body protects you. Talking, clenching your jaw, tightening shoulders, all send signals to raise pressure temporarily. In my clinic, I often see patients panic over one high reading. When we correct posture and timing, the numbers settle. One reading does not define your health. Patterns do. A single number is information, not a diagnosis. Have you ever seen one high reading that scared you? Choosing the right blood pressure machine. Choosing the right blood pressure machine may seem simple, but the choices you make can greatly influence the accuracy of your readings. For many people, the most obvious factor is brand or price. It's easy to assume that a more expensive monitor is automatically better, but in reality, accuracy and proper use matter far more than cost. A moderately priced, clinically validated machine that you use correctly is far more reliable than a high-end model that you struggle to operate or position correctly. For home use, automatic upper arm monitors are generally considered the gold standard. These devices measure pressure directly from the brachial artery and are less prone to error when used properly. Wrist monitors are available and can work, but only if your wrist is held at heart level and you remain completely still. Many people underestimate how sensitive wrist readings are to movement or positioning. A small mistake in angle or support can make the difference between a normal reading and a falsely high or low number. Cuff size is another critical factor. Each arm is different, and using the wrong size cuff can distort your measurements significantly. A cuff that is too small may constrict the arm too tightly, creating readings that appear higher than your actual blood pressure. Conversely, a cuff that is too large can fail to compress the artery adequately, giving readings that are falsely low. This is why checking the arm size range recommended by the manufacturer is essential before purchasing. Taking the time to measure your arm circumference ensures that the monitor will function as intended. Validation is also key. Clinically validated monitors have been tested in controlled studies to confirm their accuracy. This is different from devices that claim precision based on convenience or marketing. Look for monitors with official validation, often indicated by a logo or reference to recognized studies. This is especially important if you are monitoring blood pressure regularly, or if you have been advised to keep careful track due to medical conditions. Using a validated device gives you confidence that the numbers reflect your true health, rather than artifacts of measurement error. For older adults or seniors, certain features make monitors more practical and safer. A large, clear display allows easy reading, even if eyesight is not perfect. One-button operation simplifies the process, reducing the risk of user error. Memory storage is invaluable, letting you or your healthcare provider review patterns over time without relying on manual recording. These features are not just conveniences. They actively reduce mistakes and increase the reliability of your measurements. When selecting a device, consider which features you will actually use consistently, rather than the ones that look impressive but may go unused. Portability is another consideration for some users. If you travel frequently or want to take readings outside the home, compact designs with battery operation may be convenient. However, keep in mind that portability should not compromise accuracy. Even small design trade-offs can affect how well the device reads pressure. A reliable, slightly bulkier upper arm monitor is often better than a wrist device designed solely for convenience. Prioritizing reliability over portability ensures your readings remain trustworthy, especially if you are tracking trends or making medical decisions based on them. Ease of use is crucial. Some monitors offer complex features like multiple measurement modes, irregular heartbeat detection, or smartphone connectivity. While these can be helpful, too many features can overwhelm or confuse. Choose a device that you can operate confidently every time. The goal is consistent, accurate readings, not a gadget with bells and whistles that you only half understand. Your own comfort with the machine is as important as the technical specifications. Finally, consider long-term usability. The best blood pressure machine is one you will actually use correctly, every time you measure. Over time, consistent and proper use allows you to identify trends, detect changes, and understand your cardiovascular health accurately. This is far more impactful than occasional readings with a high-end or complicated device that you struggle to operate. Simplicity, reliability, and accuracy together form the foundation of effective blood pressure monitoring at home. By choosing the right machine and using it properly, you are taking control of your health in a meaningful way. This small investment of time and attention ensures that each reading reflects your body's true status. Over weeks and months, these accurate measurements build a clear picture of your patterns, helping you and your doctor make informed decisions and prevent complications before they arise. Choosing wisely is not just about the device itself. It's about creating a routine that empowers you to monitor, understand, and manage your blood pressure confidently. The best monitor is not the most expensive one. It's the one you'll use correctly. What feature matters most to you? Simplicity, screen size, or memory? Best timing to measure blood pressure. Measuring blood pressure at the right time is just as important as measuring it correctly. Blood pressure is not a fixed number. It fluctuates naturally throughout the day due to a combination of physiological processes, activity, and emotional state. These fluctuations are completely normal and reflect how your body responds to stress, movement, and even the natural circadian rhythm of your cardiovascular system. By understanding when and how to measure, you can get numbers that truly reflect your health, rather than temporary spikes or drops caused by your daily routine. Morning readings are particularly important for many people. As your body wakes up, blood pressure tends to rise naturally. This is partly due to hormonal changes that prepare your cardiovascular system for the day ahead, including the release of cortisol and adrenaline. Measuring blood pressure in the morning, before breakfast, caffeine, or medications, provides a consistent baseline that reflects how your body starts the day. Taking measurements at this time ensures that you are comparing apples to apples, rather than mixing readings influenced by meals, drinks, or activity. Evening readings also provide valuable insight. After the day's activities, meals, and mental stressors, blood pressure often begins to settle. Measuring at a consistent time in the evening, ideally after you have had a chance to relax, allows you to observe patterns in how your body responds to daily life. By comparing morning and evening readings over time, you gain a clear picture of your blood pressure trends, rather than focusing on a single number at a single moment. This consistency is far more important than chasing the perfect reading. Avoid measuring immediately after exercise, stressful situations, or large meals. Physical activity temporarily raises blood pressure as your heart works harder to supply muscles with oxygen, and stress triggers hormonal responses that elevate pressure as part of the body's natural fight or flight response. Even large meals can temporarily increase blood pressure due to changes in circulation and digestion. Measuring during these times will give you artificially high readings, leading to unnecessary worry or confusion. Consistency is key. Measure your blood pressure at roughly the same times each day under similar conditions. This creates a reliable pattern that you and your healthcare provider can interpret meaningfully. Think of it like weighing yourself. Stepping on the scale at random times will produce confusing data, while stepping on under the same conditions provides a meaningful trend. Your goal is not a single, perfect number, but a clear understanding of how your blood pressure behaves over time. Some patients find it helpful to create a small routine around their measurements. Sit quietly for 5 minutes before checking, keep your arms supported, and record the reading in a notebook or digital tracker. Over time, these consistent habits reveal patterns that are far more informative than isolated readings. For example, you might notice that your morning readings are slightly higher than evenings, which is normal, or that stress on certain days causes small but predictable spikes. Another factor to consider is medication timing. If you take antihypertensive medications, measuring blood pressure before or after your dose can influence the reading. It's important to measure at consistent times relative to your medications so that your patterns are comparable day to day. Discussing these patterns with your doctor ensures that dosage adjustments or lifestyle changes are based on accurate data rather than inconsistent measurements. Environmental conditions also play a role. Temperature, noise, and comfort can all influence readings subtly. A quiet, relaxed environment reduces the chance of temporary spikes caused by tension. Even small things like sitting in a familiar chair, having your feet flat on the floor, or measuring in a calm, well-lit room contribute to more reliable numbers. Finally, remember that timing is about creating actionable information, not achieving perfection. One high or low reading is not a cause for panic. What matters is the trend over days and weeks. By measuring consistently in the morning and evening under similar conditions, you gather meaningful data that helps you understand your cardiovascular health. With these insights, you and your healthcare provider can make informed decisions about lifestyle adjustments, diet, exercise, and any necessary medical intervention. Proper timing transforms blood pressure monitoring from a random task into a tool for empowerment, helping you take control of your heart health with confidence and clarity. One high reading means very little. A trend means a lot. Do you measure at consistent times or whenever you remember? Understanding numbers without fear. Blood pressure is shown as two numbers, usually written like 120/80. The first number is called the systolic pressure. That's the pressure when your heart pumps blood. The second number is the diastolic pressure, the pressure when your heart rests between beats. Both numbers matter, but what's even more important is the pattern over time, not one single reading. Many people panic when they see one number that seems high. I see this often in my clinic. A patient takes one reading at home, sees a slightly elevated number, and suddenly worries that something is seriously wrong. But one reading does not define your health. Your body responds to so many factors every day: stress, activity, sleep, caffeine, and even the time of day. A single high number might just be a temporary response, not a chronic problem. That's why tracking patterns is key. When you measure at consistent times and follow proper technique, you start to notice trends. Maybe your readings are slightly higher in the morning or after stressful meetings. That's normal. The important part is to look at multiple readings over days or weeks. Patterns tell the real story, not isolated numbers. It's also normal for readings to fluctuate. Blood pressure naturally rises and falls throughout the day. Instead of worrying about every little spike, focus on consistency and understanding your body. Learning what your normal range looks like gives you confidence. You'll know when a reading is truly unusual and requires attention, and when it's just a normal variation. Remember, the goal of measuring your blood pressure is information, not fear. Each number is a clue about how your heart and blood vessels are functioning, and with correct measurement, you are giving yourself a reliable picture of your health. Over time, this understanding allows you to make informed choices, notice changes early, and feel more in control, without panic. When patients in my clinic understand this concept, they often feel relieved. They realize that one high reading is not a disaster, and that small adjustments in lifestyle or technique can make a real difference. Calm awareness is much more powerful than fear. Awareness creates options. Do you track your readings or rely on memory? Common mistakes: talking during measurement, crossed legs, holding your arm up. These raise readings, not because you're unhealthy, but because muscles react. Correcting these often lowers readings naturally. Sometimes improvement doesn't come from medicine, it comes from accuracy. Which mistake surprised you most? Here's the hopeful truth. Many people see 5, 10-point improvements within weeks by measuring correctly, sleeping better, moving gently, monitoring consistently. You don't need perfection, you need understanding. Health is not control, it's awareness. What small change feels doable for you this week? If this helped you feel calmer about blood pressure, I want to hear from you. How often do you check your blood pressure? And do you follow a routine? Comment below. Sharing your habits can help others understand the importance of proper measurement. Share one thing you learned today in the comments. Someone else may need that reassurance. Before we wrap this up, one important thing to keep in mind. This video is for educational purposes only. I'm sharing general guidance so you understand your body better. Everyone is different, so consult your doctor for advice specific to your situation. If you have symptoms, concerns, or existing medical conditions, never delay seeking professional care. Always speak with your healthcare provider about what's right for you. Stay tuned, because what comes next is something your doctor may never have explained this clearly before. Take a slow breath. You're learning. You're paying attention. And that already matters. I'll see you in the next video.